If you improve your body, if you improve your physical health, it'll improve your mental health. And that's what we have seen many, many times. And also, people think that, oh, this drug works only to this part of the body. No, it works everywhere. It'll have sometimes devastating effects. This kind of therapy will work for depression. We've seen that in stroke patients. When people have heart attack and stroke, they go into depression right after that. And that's a very well-known fact. But how do you flip it? How can you take, the physical body as you're healing and improve that depression? And then this thing works for that. I agree, totally. Great question. Yes, there's a question here. Thank you.
Hi, this is Sarang. So very interesting topic because autism is growing, like you're saying. I think more it is of people are getting detected now versus the past, right? So your approach is very interesting. Just wanted to understand. So I just checked your website. Other than the robotics part, the other 3 parts that you have, can this be like this? Service be provided online so that it can reach a wider audience right away rather than bringing some machine in one place? Because virtual reality, I guess, can be done, gaming can be done, exercise can be done all online.
Yes, everything can be done online. Very good point. How do you get a low-functioning person to do vigorous exercise through online? Exercise is the key, right? Yeah, okay, you can go play soccer, you can go lift weights, you can do that. But how do you motivate a person? It's almost impossible. They maybe 1%, 2% may be able to do it. But these are people that you need 2 people to go along with them if you want to go to the park. Because you don't know, they might run away, they might hit somebody, or they may not want to move, right? How do you motivate those people? So you need a physical thing, a physical space. Sure, maybe once they get into the program, and we don't know that it might be possible to do online. And the same question people ask, why can't they go to a regular gym and do the workouts? You need a specially trained person who can deal with people with autism. You need a special equipment because you don't want them hurting themselves. You need a special place because you cannot just leave them in the crowd to fend for themselves. So it is a very, very complex problem, and it needs a specific place. We tried that. So my daughter goes through 5 different programs right now before the machine, 5 different programs, 5 different special coaches that deal with autism, because you need to understand those people. It's a very different population. Yes, I hear question. Definitely, there is a way. And that's what we want to do. So in our initial study, we wanted to see, will they use it? Will they enjoy it? Enjoyment is a big factor. That's what makes it sticky. How do you make people enjoy exercise that you cannot communicate with, that cannot tell you what they're feeling, right? You have to make them sticky. But once you do that, so we have measures for anxiety, we have measures for aggressive behaviors, we have measures for sleep. Sleep is very important. And we have measures for focus. These are the 4 things that we'll be measuring in our next study. So we have a connection at Stanford University that they are interested in this. And when we bring the machine here, set it up, we'll be recruiting patients for that study. And that will tell us, give us definitive outcomes data.
I see. Do you have any initial numbers, like
No.
of the 9 people?
No, I don't have, because we did only a small study with 9 patients. The initial numbers we have is for how much fun is it? And the score, based on the person's level of communication, the caregivers also rated it. How much did he enjoy or did she enjoy? And it was 9.3 average score out of 10. That means that, and everybody wanted to come back for more sessions, but we only ran it for a week, so we could not. But that shows that, okay, they are enjoying it. They can sit on the machine. They don't mind putting on VR goggles. And here's the key thing. How do you teach a lower functioning autistic person how to play the game? They have to learn by themselves. I mean, they're putting on headphones, goggles, and then they have to figure it out. So the game has to be so intuitive and so sticky that they have to learn. And every one of them learned within 3 minutes on how, it became so intuitive. And most of them have never worn a VR goggle or played a video game in a VR setting. So that's how it works. Okay, looks like there are no more questions. Thank you very much. And the website is Sirica TX.
There was one more question.
Please check it out.